Dr. Inderjit, welcome to Coffee with Professor Leif Ryd. As
Thank you.
Professor Leif Ryd is the founder and board member of Episurf Medical AB. I want you to use this opportunity to identify what kind of patients with osteochondral lesions are the ideal patients for episealer. Over to you.
So, when we talk about osteochondral lesions of the talus in India, mostly they are missed. The question of being a criterion for an episealer or not is very secondary. It's first to make the correct diagnosis. You need to be correct. You need to find the cause of the pain there. So what most of us miss, we keep looking for fractures. Patient has pain. We don't do a proper clinical examination. Once we do it, once we know there is an osteochondral lesion, then comes the episealer role, right? Personally, I have had experience with only 2 of them. Both of them were medial lesions, most common ones, and episealer worked really well. So for athletes, for people where you don't want to fuse the joint, this is one of the best things to happen.
Yeah, that's true. I think, obviously you need to assess a patient, you need to have to image the patient with, preferably with CT or an MRI. You need to have a look at the lesion, at the talus, and you need to have a look at the opposing side, opposing cartilage, which I would say in our experience, the opposing side is usually quite all right. These are oftentimes traumatic lesions. Oftentimes it's just a little fissure in the cartilage, and then by a valve mechanism, joint fluid is squeezed down into the fissure, into the bone, and you have a large big cyst in the bone that does not affect the opposing cartilage in any way. So such a case would be excellent
for an episealer. Yes,
for an episealer.
You
fix you open the cyst, you put an episealer in, which seals the hole in the cartilage, so there is no more joint fluid being squeezed down, and then the cyst, even if a bit of the cyst is left underneath the implant, that cyst will heal spontaneously actually. So those cases are very good.
Yeah, that's very true. So the last case we saw, he was a 35-year-old athlete, and he healed very well. We did not have to go deep down and remove the whole cyst. We filled it up with the episealer and it healed very well. So yeah, I agree.
I'm happy to hear that.
So symptomatically, what are the kind of symptoms you feel orthopedic surgeons should find out for an osteochondral lesion?
I think the ones, depending on the kind of lesion we have, if you have an osteochondral lesion, which is a traumatic with a loose implant, with a loose body, or then you may have catching episodes. But the cyst, a cyst is under pressure, and the pressure gives you chronic ache. And so that would be the problem of that kind of patient.
It's most commonly the axial loading which happens on the talus. So a small cyst keeps growing, but the other side of the cartilage, as Professor Leif Ryd said, remains intact. So there's no role for something called as a total ankle. You don't need to go to the other side. You just have to fix the one side, and then the cyst heals.
That's what I believe is the case, right? And the talus is a perfect joint for that.
Yes.
The talus the ankle joint is really an extraordinarily forgiving joint. Yes, because it's a true hinge. It doesn't, like the knee, also rotate. It's a true hinge. And it sits at the lowest part of the body. All the body weight is carried through the ankle, and relatively speaking, there are pretty few lesions. So it's a good joint, good construction, if you like.
So, Professor, I hope you enjoyed the Congress so far. You're in the second day of the conference. Did you like the conference?
I do, yes, I do, and I enjoy the the good science and the eagerness for discussions. So no, it's great fun. It's great fun to be here.
If that's the case, I think you should congratulate Dr. Inderjit. He's the secretary of the association.
So yes. I'm so happy to do that. It's
Thank you.
You've done a good job in creating an interesting society. Curious. With a lot of curiosity.
So the research, it helps all our patients.
Yes.
Getting new things, it helps. People are not aware, especially of episealer. There are very few people in India who are actually aware of this thing happening.
I know.
Thanks to you, Mohan, we are able to bring it to the masses. So it will be great how the journey pans out.
Yes. It's a very exciting journey that we have embarked on here in India.
Thank you, Dr. Inderjit. I think you can shake hands for and congratulate him for the wonderful workshop.
Thank you very much.
Thank you.